Let's see if you can identify these surgical forceps like a surgeon. 5 seconds per instrument. Ready? Let's begin. This is Ali's forceps. It has serrated blades, no interlocking tooth, used to hold tough structures like fascia or sheath. Remember, Ali's grips tissues firmly. This is Cocker's forceps. It has interlocking tooth used to hold pedicles, common in bowel resections for the specimen site. Cocker grips even tougher tissue than Ali's. This is Babcock's forceps. It has the rounded atraumatic ends, holds tubular structures like appendix, ureter and fallopian tube. This is Desjardins forceps. It has a tubular tip used in choledocholithotomy used to retrieve CBD stones. This is Kittle's forceps. It is used to pick sterile instruments usually kept in antiseptic solution. This is the Rampley's sponge holding forceps. It is used to hold sponges, used for painting and preparation, and can be used to hold gallbladder as well. This is a needle holder. It has short blades with criss-cross serrations and a deep central groove. It is used to hold surgical needles during suturing. This is curved artery forceps. It is used to clamp bleeding vessels, open facial planes and pass ligatures. This is mosquito forceps. It is a small hemostat used for tiny bleeding vessels. These are right-angled forceps. It is used to pass ligature around pedicles, like for superior and inferior pedicles during thyroid surgery. This is Mayo's towel clip. It fixes drapes in an operative field and is also used to hold suction tubes and diathermy wires. So how many did you get right? Comment your scores below. For more such surgical quizzes, follow the Surgical Mind.